Hello, I am Dr. Anamika, gynecologist and IVF specialist from Midas clinic. Today we are going to talk about puberty in girls and our role as parents. What is puberty? Puberty is simply the stage of life when our girl changes from a child to an adult, physically and mentally. So we as a parents are supposed to take care of all the three spheres of our life: physical, physiological and psychological. So let's take them one by one. When we talk about the physical aspect of her puberty, that means we are talking about the growth and development, which mainly consists of giving her good nutrition, exercise and sleep, which we have already discussed in our last video on her first cycle. One more important thing which happens in the physical growth is breast development of our child. When breastfeeding starts, there are few things which are very common but they may trouble the child, like having unequal growth on both the sides is completely normal in the beginning, and in the later stage of life also not all females have equal size breast on both the sides. Having mild itching and pain in the breast area is completely normal, and the child needs to be explained about it. Now, next important question is when to start use of bra. Actually, this should not depend on the age. If the child is having any discomfort in exercise and physical activity, or if the child is chubby, we can start it as an earlier age. There is no problem with that. Now, the next aspect of her life is the physiological changes which is occurring in her body. That is the functional changes. Most important of which is menstruation. With the beginning of menstruation, we need to teach her about menstrual hygiene. Hygiene is important in everyday life, but during menstruation, there is blood around vagina which can bring infection, rashes in the short term, and in long term may lead to chronic pelvic pain and diseases which can lead to infertility and maybe cervical cancer. So we have to take it seriously and watch that our kid is maintaining menstrual hygiene efficiently. For that, we'll start taking each and everything one by one. In those days, we are supposed to encourage our kid to have bath every day. Check that she is using only cotton panties, and when after peeing or using washroom, she is standing from the sit, she may make her panties wet. So we have to take care of that also. Use of menstrual products like pads should be clearly explained to her so that no swelling occurs. Always take care that she is changing the pads after 6 hours, and in the beginning of the menstrual cycles please see that the pad is not over soiled, and encourage her to change the pad even if there is no swelling. She is not supposed to keep it for one day. If there is no bleeding, she may not change, so you have to take care of that also. Now, when she washes her perineum, you have to see that she uses the jet of water in a proper way. That is from front to back and not from back to front. When the kids uses the jet of water from back to front, they may lead to infection due to the bacteria which are lying in the anal area entering the vaginal area. Now, when we are talking about washing of the vagina, it's very important to point out that use of only mild soap and water is needed. There are so many marketed vaginal washes in the market, but vagina doesn't need any kind of vaginal wash. Vagina is just like nature. When we say that we need to save nature, this is just an arrogant saying. You don't need to save nature, you just have to stop destroying it. Similarly, for vagina, you don't need to maintain the pH by using various vaginal washes. You just have to stop destroying it by using chemicals. Now the next thing is pubic hairs. If the pubic hairs are troublesome, the child can get it trimmed. Otherwise, we just need to explain to them that any hair on any part of our body is not going to harm us. As we have taken care of the menstrual hygiene, the next thing is taking care of their psychological needs in this stage of development. And according to me as a parent, this part of care is most important. If you have taken care of this aspect of a child's life, you are sorted. This is psychological and mood changes are basically due to two aspects which are changing in her body: the hormonal changes and the changes in the brain development. When we talk about the hormonal changes, they don't only bring menses, but they also change the mood of the child. They can show fluctuating moods. They can be angry, happy, sad, frustrated, and they will now start showing a bit of attraction to the opposite sex. They may be exploring their own body, and the child may start masturbation, which is completely normal. We don't need to overreact in all these things. So how to tackle these mood changes in the kids? There is a 3P mantra for the parents, that is, be prepared that the child of this age, that is 9 to 15, will behave like this. Have patience, don't lose your calm, don't overreact, accept the facts that the child is changing and you just need to explain the things to her. And presence, that be there, just be there to tell her the right things in these years of her life. Now let's talk about the brain development. As we already know, the major change in size of a child's brain occurs in the age group of 0 to 5. That is, it reaches 90 to 95% of the adult brain size. And the next stage of rapid growth occurs in this age group, that is the age group of adolescence. In this age, the brain is not only increasing in size, but it is also undergoing remodeling and fine tuning. You can compare this to interior designing of a house. When you start interior designing, you will throw away a few things which you don't need now, and in the same way the brain is pruning the part of the brain which is not being used. That is, either you use it or you lose it. And the next thing which is happening is fine tuning of all the functions of the brain, and this starts from the back of the brain to the front part. So the child has started to have the capability of enthusiasm, impulsiveness, but the part of the brain which acts to tell her how to judge, how to think of consequences, and what is the risk in all that, this part of brain is not yet developed. So this explains the child's behavior in this age group. So what we parents are supposed to do? There are a few R's to the rescue of parents. Range of activity. Give your child a wide range of activity to do so that her brain is developing at a good pace. Like engage her in sports, in painting, in arts, dancing, music, whatever she likes. Risk. Allow her to take healthy risk so that she can grow to an independent individual, which she is trying to do, and sit with her and talk about the consequences too. Be a role model for her. Be a positive role model for her. Your behavior, your attitude towards life must encourage her to follow you, so that she is not following someone else, someone from the social media, or getting influenced by someone else from the community and may take wrong behavior habits. Next is refrain from social media at this time for the girl, because they are not very intelligent to judge what is right and what is wrong, and cyberbullying and sexting, this kind of things can happen very easily. Next, have a family routine. See, telling the child to wake up early, do this, do that, is not going to work. But if we have a family routine that the whole family does it in the same manner, the child will follow. This brings a sense of belonging and discipline. And the next is reward and review. That is, You should always praise her good behavior. Whenever she is well disciplined and she is doing the work as desired, you should always praise her so that her self esteem is maintained. And review, you should always have a look on what kind of friends she is having and what kind of activities she is indulging in. And at the end, I will say that you must not forget to tell her often that what a wonderful daughter she is and what a proud parent you are. Thank you.